Hello, in this video, I'll be talking about patient-reported outcomes. What are they? Why do they matter? What should you do if you're asked to complete them? And what's the impact on your care? Before I go on, I'd love to invite you to subscribe to our channel. We put out about 3 videos a week, so there's always something new to watch. So patient-reported outcomes are just what they sound like. These are where we ask patients how they're feeling, and the outcomes I'll get to in just a moment. But when you go to see a physician, they will ask you about symptoms you're having, and they'll do an assessment, and they will often assign a level of severity based on the sense that they're getting from you. When patients directly report how they're feeling, symptoms or quality of life, it's more accurate. And often we will ask people in these instruments, whether it's a paper survey or something on the computer, we will ask people, to what extent does that symptom interfere with your quality of life? It's been shown that there's a disconnect between what a medical team will say are symptoms the patient's experiencing and what patients report when they're asked using structured tools like a survey. So we're finding over the last decade or so of collecting patient-reported outcomes that patients, when they report their symptoms and the severity of those symptoms, that patients are more willing to report the severity and whether they're having a symptom when it's not directly being asked by the doctor or other person on the healthcare team. And in fact, when it's given to sort of a third party, whether again it's a computer or a piece of paper. So perhaps people feel like they're complaining when the doctor asks, but they're more forthright and feel freer to report their symptoms when they're not reporting it directly to a physician or other member of the care team. It's kind of interesting because physicians think they know their patients, but it's been shown that the closer somebody is to their patient, the less able they are to report the symptoms the patient's having. So I'll repeat that because it's paradoxical. So let's say you have a great relationship with a medical provider and they feel the same way. They feel very connected to you. They feel they understand you, etc. They can pick up on how you're doing. It's actually the case that those patient-clinician relationships actually yield inaccurate assessments of how a patient's doing. The physician will usually think the patient is doing better, feeling better than the patient actually is. I suppose it may be because we create this story that the patient will tell us everything, and the patient feels, I feel so close to the doctor, I don't really want to divulge how badly I'm feeling. I don't want them to think differently of me. So these tools are really, really important in understanding how patients are feeling, not just at the individual patient level, but in terms of how quality is assessed and in terms of how the physician and the whole care team can do better in improving their performance in managing symptoms. So let's say you're feeling really well one time, but the next time you're not feeling as well, giving that feedback to the medical team, whether they see it real time or whether it's given to them in a report, can help them improve management of certain symptoms. So I've mentioned symptoms a few times. What exactly are we talking about? We're talking about fatigue, we're talking about pain, and we're talking about how much does the fatigue interfere with your daily living, with your ability to function. So if you normally are a high energy person, even a slight decrease in your energy can have a huge impact on your quality of life and how you can get your work done during the day. And I don't just mean work at work, but all the role functions you fulfill. Whereas some people who don't have a lot of demands on them, if they're a little tired, there's not much interference. It's likely if you're watching this, you're saying, really? Fatigue interferes with my life. But there are people who don't expect a lot during a given day, so fatigue doesn't interfere much. Same with pain. People who have pain, the level of pain can be very high, but they're managing to perform all the daily functions that they need to do, and somebody else might have the same level of pain and it's interfering greatly. So these are things that we'll ask. We also ask about numbness and tingling in the fingers and toes. We ask about nausea. We ask about appetite. We ask about diarrhea, and we ask about constipation. Some patient-reported outcome platforms ask about your mood. Are you sad a lot? Are you anxious? And you being able to convey that to the medical team can be really important in helping them understand how you're doing with treatment. Do changes need to be made in your treatment? And it's another way for you to express your needs and your experience. It's also been shown that if you report how you're feeling, even if the physician or other members of the team don't see that in real time, this can improve your outcomes. And I think it may be because our hypothesis is because it raises your level of awareness that we care about these things. So I'll give you an example of an encounter where, let's say you're having constipation and the medical team doesn't ask you about it, and doesn't come up in your visit, but a form asks you about it. You might actually say, oh, I actually didn't know that constipation could be a problem during treatment, and you're more likely to bring it up. Even if the doctor or medical team doesn't see that you reported constipation, it raises the level of awareness in your mind and makes you more likely to bring it up, if not when you see the oncologist or radiation oncologist, maybe when you head over to treatment. I'm hoping that's clear, but we have a recent study demonstrating there's an improvement in survival in people who are asked to complete patient-reported outcomes, even if the medical team doesn't see the result. There are quality initiatives that compare one practice versus the other on how patients report pain and fatigue and other symptoms. Because if one practice, let's say, is doing a really good job and another practice not so good a job, you can actually use patient-reported outcomes to measure quality. So there are a lot of reasons to complete these. So I'm talking about completing these. How might you know if you're completing a patient-reported outcome? Well, if you're in a clinical study, it's very likely that you are. Nearly every clinical study collects patient-reported outcomes. You may be given a survey that asks about your symptoms on paper. You may be asked to complete these on your patient portal. You may be sent a link to complete them at home before you come in that's separate from your portal, or you may be given something to complete when you're in the office. It may be a station where you go in and you press buttons and fill out how you're doing. It may be something on your phone. It may be something on a tablet in the practice itself. So in terms of why people do these and what they're good for, it's really helpful to know, I think, that these can be part of your care plan, and they can also help your medical team do better for other patients coming forward. Nobody wants to complete another survey, but knowing what these are used for in your own care and knowing that they can improve the care of a patient who comes in next week or next year can be really helpful. Drop a comment or question below. If you completed surveys like these, patient-reported outcomes, what do you find good about them? What do you find frustrating about them? And of course, you can ask us questions. While we can't give direct medical advice, we can answer questions generally about patient-reported outcomes or other things that you might be experiencing. Thank you for watching.